Hello, today we are going to talk about a common disease that has high rate of death. The disease is hypertension or high blood pressure. About 1 billion persons all over the world are living with high blood pressure. And among them, more than half of them do not know that they have hypertension. Among the people that know, 4 out of every 5 of them are not controlled. And it is estimated that any 3 persons you see, one of them may be hypertensive. Now, what are the risk factors of hypertension? In the video today, I'm going to give you 15 risk factors of hypertension and how to go about it and prevent yourself from having high blood pressure. The risk factors are the things that are living with us every day, and they are the things that you can do something to protect yourself and your family. If you are new in this channel, this is the channel that brings about early warning signs of diseases and what to do to prevent some dangerous diseases. Please subscribe to this channel by subscribing and clicking the bell icon so that from time to time we bring out new topics and you will be the first to know. What are the risk factors? Are you at risk of hypertension? The risk factors of hypertension are divided into two: modifiable and non-modifiable. Modifiable ones are the ones that you can change, while the non-modifiable ones are the ones you cannot change. Luckily enough, the modifiable ones are the ones we can do quite a lot of things in order to help ourselves. Non-modifiable ones is age. The older you are, the more likelihood of you getting hypertension. If you are above the age of 40, you are at risk of hypertension. Race, the black race is more at risk of hypertension, although it is common in every race. Family history, if you have a father, mother, or first degree relative that has hypertension, there is a likelihood that you can also develop hypertension. Genetic variations, some of the genes for hypertension have been coded, and if you have that gene, eventually you will have hypertension. These are the non-modifiable factors and risk factors of hypertension. The modifiable factors are: number one, obesity. If you are obese, having a BMI of more than 30, you are at risk. If you eat unhealthy diets that are not balanced, you are at risk of hypertension. If you take a lot of salt, that is sodium chloride, in food, either directly in your food or in the confectionaries that you take, you are at risk of hypertension. If you take excess alcohol, more than 3 units in a day for men and more than 2 units in a day for women, you are at risk of hypertension. Have you been diagnosed diabetic? If you have diabetes, you are at risk of hypertension. Do you smoke? Smoking also puts one at risk of hypertension. So smoking should be stopped entirely. It's not reducing the quantity of sticks in a day, but to stop smoking entirely. Those that have low vitamin D will also be at risk of hypertension. Also, lack of exercise. Do you exercise more than 3 to 5 times in a week? Do you put in up to 75 to 150 minutes of exercise in a week? If you don't, you are at risk. Sedentary life. Do you sit down for more than 4 hours in a day? You are at risk of hypertension. If you are from low and middle income countries, like most African countries, you are at risk of hypertension. Also, do you take many medications for different ailments? Because some drugs, such as pain relieving drugs and steroids, can also cause hypertension. Are you the type that pass through a lot of stress, enormous stress? Stress can also predispose you to hypertension. After mentioning all these things, it seems as if no one is free. But that is not true. Many people are also free because they can have lifestyle modification. and it will prevent them from having this disease that is very dangerous and taking a lot of life on daily basis. The risk factors are displayed as I've talked before. So, what can you do? How do you prevent all this? The aim is to have a good lifestyle modification. Don't let high blood pressure kill you. Please subscribe to this channel and hit the bell notification so that whenever we bring out new topics, you will be the first to know. Thank you and thank you.